there's a lot of people that have asked for the recording because they couldn't join. And then Chelsea Belton and I will we'll look at chat, monitor the chat. So if you have any questions at all, please put them in chat, and Chelsea and I will make sure that they're answered. And then just a couple things about ESA, you guys. I think most of you know this, but the last 6 years, we've partnered with ADP, and we've built a network in 20 cities with about 2,000 CHROs, CIOs, and other executives. And everybody, I think, that's been in our events knows that we believe that we've included CIOs and other executives in this because we really do believe that everybody has to be involved in the talent acquisition and talent retention area. And then also we offer work tech startups. We had one of those yesterday, and I think it was pretty fun. We had a great startup, and we do this once a month. And then we also offer a board positioning membership. And I'm in the process right now of going back to the people that have signed up for that. And we're going to kind of revisit how we're going to do that in the future. So watch for this in January, because we're going to have some changes to that. So this summer we offered a Best of Wellness Wellbeing series, and we brought in about 20 different applications, point solutions for wellness and well-being. The reason we did that is because we believe really strongly this is becoming a board level conversation. In fact, Fred's got some statistics that shows, based on a CEO survey, that the boardroom and the CEOs are definitely looking at this. And I want to just add one thing. One of the CHROs that I know really well, I asked a few weeks ago, are you guys starting to look at this at the executive team level? Are you talking about well-being? And she said, absolutely. And I've been told to spend whatever I need to be able to offer the right benefits to attract and retain talent. So I think that it's a topic that maybe is a little ahead of its time, but definitely it's an emerging topic. So we have really been excited about partnering with Segal. We partnered with Fred for the last couple of years, and Segal has a mission of providing trusted advice that improves lives. And you'll see here in the next hour with Fred and his team that they really, really believe that. So with that, I'm going to turn it over to you, Fred, because I think I've made the point. Well-being is important. It's very important in the boardroom and at the CEO level right now. And Fred and his team will talk about what other companies are doing and what they found out through the survey that we just got the results of through ESA. So Fred, it's all yours.
Yeah, very good, Cindy. Thank you. And thanks for having us today. And I want to tie it back to something you said earlier, this whole operationalizing well-being. You know, with the challenges we're having with labor and skill shortages, your number one recruiting channel is a healthy and productive workforce. And that's being proven out over and over again. We conducted a survey back in September on this topic of operationalizing well-being. More than 100 organizations within this network participated. A sincere thank you to all you who participated. We gathered a wealth of information. And so my colleagues, who are really the brains behind this, they're each going to have an opportunity to kind of share their piece of this, and then holistically we'll wrap it up at the end. They've gone through this data, correlated it, found some key insights. And so we're going to share the results of that survey in a summary form, and then we're going to weave it into each of the sections of what we're going to share with you today. And as Cindy mentioned earlier, you're going to have questions, you're going to have comments. We'd love to hear from you in the chat area. Cindy, we may have some folks come off mic as well and have a conversation. We'd love to make this more of a dialogue. This is a thought leadership forum after all. I'd like to thank my four colleagues, Joanna Balo Reynolds, Chelsea Belt, Chris Calvert, and Jonathan Price, and they're all going to introduce themselves when we get to their section. And again, they've worked diligently on this data, and they've looked at it in terms of individual dimensions of well-being, but also holistically across the four dimensions. And I think that's what makes today's conversation very unique. Quick commercial about my company. Segal is a business HR and benefits consulting company headquartered in New York City. We've been around since 1939, and no, I was not a founding member. Our mission is to provide trusted advice that improves lives, as Cindy said earlier. And what could be more core to improving lives than well-being? So we think this topic is very timely for a lot of reasons. And if we can move on to the agenda. So Chelsea's going to take us through a quick summary of the survey results. Chris is going to address the physical wellness aspects. Joanna's going to cover mental, emotional, and social wellness. And Jonathan's going to focus on financial wellness. Now, we didn't put these in any kind of order of importance or magnitude. They're all important, but together they're really, really powerful. And finally, we're going to wrap up a discussion around holistic well-being, bringing these dimensions together, and hopefully what you're taking away from today's forum. So if we can move on. So with that, we can move on to the next slide. So there are many definitions of well-being and wellness out there. Key is that they're not the same thing. We subscribe to these definitions. Well-being is the ability to cope effectively with life on a mental level, namely stress, emotional, things like anxiety and fear, and financial uncertainty, for example. Whereas wellness is really the ability to maintain a healthy quality of life and manage health risk factors by focusing on physical needs like diet, exercise, and sleep. Although they're not the same thing, they do go hand in hand. So if we can move on. So as it turns out, well-being and wellness are not only go hand in hand, but they're highly interdependent. For example, physical problems can lead to mental and emotional issues and can create financial challenges. Financial challenges can lead to higher stress levels and possibly physical problems like high blood pressure. And then mental, emotional, and social issues can lead to poor dietary, exercise, and maybe even poor spending habits. There are many places and opportunities to improve well-being, as you can see on the left, the wheel, such as the workplace, our communities, where and how medical care is provided, our daily routines, and working with financial advisors, just to name a few. And if we could move on at this point, with that as a backdrop, I'm going to hand it over to Chelsea, and she's going to walk us through the survey results from September.
Thank you, Fred. So thanks for your introduction as well. One thing Fred did not mention about me is that I love data. So I was thrilled to be working with ESA to survey these 100 plus executives, which you'll see part of the results here and a bit more of in a moment. So we surveyed executives at different levels, had CEOs, CHROs, presidents, etc. And we did that across many industries all over the globe. We asked them various questions on their well-being initiatives, successes, and opinions, and we had some really terrific responses. And that helped paint a picture on where well-being lies on a priority list for companies and what has and will kind of become of that. So going back to why I love data, as I just said, data tells a story, and sometimes that's always not an obvious one. And some of the responses we received were no surprise, but some really added to the story my colleagues and I are speaking about today about the nature of well-being right now. My team and I analyzed the results we collected by breaking them out by industry, employee size, geographical locations, etc. And we drew conclusions from comparing pre-responses answers as well to the survey choices. And we additionally made some comparisons to other data sources. So I've highlighted a few of the survey questions that we had because we had a lot here today. But since we only have an hour, I'm going to start with just a few of them. But with this one you see here, this is an obvious observation, I would think, but it's still a crucial one. So all in all, 86% of executives find well-being a high or medium priority. And one call out I also want to mention is a box on the right that almost 100% of companies with 5,000 plus employees answered medium high. So another reason why we're here today, this is a big feat, definitely on the priority list. So we had over 20 questions we asked in our survey. And since we only have an hour, as I said, I wanted to break it down for you to show these results in kind of a certain order. So basically, I'm going to start here on how executives have managed or handled well-being in the past, the last year. And then I'll get into how they monitored those. And finally, what the future brings or how they plan to address well-being in the next 2 years. So again, starting here, you'll see that executives have tackled the past year with well-being in various different ways. It's interesting to note that the majority of these are over 30% for each answer. And that makes me believe there's clearly diversity of solutions that companies are currently utilizing, and no one size fits all. So to quickly break it down by industry, there wasn't a lot of difference to the total results here based on different industries of healthcare or financial services, etc. And same goes for geographical region. However, companies that had higher revenue, maybe 500 million or more, or ones that had larger employee sizes, are utilizing all of these options far more than others. So this leads me to believe that bigger corporations are getting ahead and playing a part in this for a reason. Okay. And then since there's many options being utilized to address well-being, as we just saw, one of the biggest hurdles that companies are facing are implementing and tracking how successful these decisions are that they're doing by monitoring them and measuring the impact, or the ROI, if you will. So even though each of these might seem like they pertain to one part of well-being, I also want to circle back onto the theme that I keep mentioning of them being interdependent. So they're monitoring these, but are they monitoring just for physical, mental, financial? Yes, but also they're measuring it for them all. So for example, accidents on the job, you immediately link that to maybe physical wellness, but accidents could also be contributed to fatigue or weakness from inability to purchase healthy food, which is a financial well-being aspect, or maybe lack of concentration or focus from anxiety or depression, which is a mental well-being aspect. Another example would be participation in tax-advantaged savings accounts. So you would immediately link that to financial well-being. This could also be attributed to physical well-being in order to prepare possibly for an unexpected sickness or injury off the job, which would lead to a loss of employment, or the inability to manage debt and finances, which can't handicap the contribution of these accounts, which would be financial well-being aspects. So even though these are being monitoring, again, these hit all parts of our pillars of well-being that we're talking about here today. And then earlier I said I wanted to cover what is planned for well-being going forward in the next few years. And so this question, it speaks just to financial well-being, but we can still draw some conclusions because again, these are interdependent and hit all the pillars of well-being. So financial well-being is an emerging market, which is tied to why there's so many selections here answered. And although many you're familiar with, I also wanted to just touch on the life cycle accounts, which you might not be as familiar with. So these manage all the costs of the assets that you could incur in your lifespan. So this includes initial investments, future additional investments, annual recurring costs, and disposable costs, etc. Just in case you didn't know the definition of that one. But you'll see that there's so much diversity and still many unknowns. So looking at the 31% that say they don't know on what works and how. My colleague Jonathan will cover this a little bit more, but it's definitely interesting to see this well-being aspect is such an emerging market. Okay. And then the last data point I wanted to cover revolves around the impact. So I just wanted to show what we're seeing companies are doing, how they're doing, what they're measuring, what they plan to do, etc. But here are some free responses that kind of show the ramifications of all of that. So I'm going to pull up each one quickly because I thought these were super interesting, excuse me. So first one is happy employees, high retention. We'll get into that. Handling burnout is a part of well-being. Balancing well-being is essential. The correlation to balancing this with your business. Better quality and again, retention. The future of workforce and the impact well-being initiatives have on them particularly. Oh, and then, yep, sorry, that was the last one. And then, yeah, so I think these kind of serve as a good segue on what my employees or colleagues are going to cover on how these are impacting employees. And Chris, I'm going to turn that over to you.
Great, thanks, Chelsea, and good morning or afternoon, everybody. Hope you're having a good day. I'm very excited to be here. I'm Chris Calvert. I run Segal's health practice. So working in our world of benefits, health is kind of everything but retirement. So health, medical, disability, pharmacy, all those kinds of things fall under me. I've been in this space for about 30 years, working at a hospital and a pharmacy company, and then kind of wanted to come over and do something valuable with it and rewarding and help employers manage all these things. So that's how I landed at Segal, and have a real passion for understanding this and how we can make an impact. So Chelsea, if we could jump to the first slide, let me walk you through this all for a second. This is data on the left-hand side from a study that the Business Group on Health recently published. That what it shows is the places and the types of illness and ailments that employers are seeing the most growth in terms of expense and cost going forward. So this was 20 to 22. And then they also asked employers, what are you expecting to see going forward into 2023? And most, about 82% of them said they're expecting to see even steeper increases in costs going into 2023. So two interesting points about this. One is that if you look at the types of ailments on the left, and you look at the right-hand side, all of these are types of services that well-being and wellness programs can impact. So whether they're doing screening or care coordination or early interventions or weight loss programs or exercise programs or any of those things, every single one of the top drivers of cost increase can be impacted by well-being. The other thing that's probably more exciting for me as a fellow data geek of Chelsea's is that this is the first time that I've been able to point to something and say, there's probably real evidence of ROI of wellness here. So when the pandemic began and we started to realize that this was going to be a long haul scenario, what we did in the health industry is we said, wow, how much care is going to be foregone and how much of that care is really preventive care? And what we saw in 2020 and 2021 was people not getting their screenings, not doing their wellness visits, not doing their normal checkups, not keeping up with their medications the way they should. And the impact of that is what we're going to see, what we're starting to see in 2022, and what we're expecting to see, and everyone is expecting to see in 2023, which is that healthcare costs, instead of rising 4 to 6% per year for employers, are expected to rise 8 to 10% per year. So if you had any doubt, before we move on to the really important and more holistic views of well-being and all these other areas of stress, etc., my old school plea to you is, don't forget physical wellness. It matters. It has a tremendous impact on both your employees and your finances. And what we've seen for the first time with pretty clear evidence is that when you forego it, costs go up and care gets more expensive, and the physical condition of your workforce gets worse. So I know this is a lot on this slide, but it really does tell to me an unbelievable story of how important and impactful physical wellness can be. Chelsea, let's move to the next slide, please. So it's nice of me to say, go ahead and do it. But the hard part is, where do we begin, or where should we focus? So, what we've seen in the past 4 or 5 years is this unbelievable influx of money and PE money and startups in the healthcare space. If you look out there in 2022, there are 165,000 healthcare startups, right? And I don't know the exact percent, but most of them feel like some kind of point solution targeting a healthcare issue. And so where the heck do we begin? So we at Segal have looked at all the different areas that startups can be effective, that these point solutions can be effective. And these, if you need to start, these are the 4 places, okay? Start with PCP, physician consultation in a virtual world. We saw that most people have already adopted that during the pandemic, but that will evolve and continue to evolve. Musculoskeletal care, it is unbelievable how well you can do physical therapy at home with technology, and how effective it can be, and how much more effective for both you and your workforce in terms of not having to leave work at 3 o'clock to go to physical therapy. You can do it on your own time, and the compliance is better. Chronic care conditions and behavioral health. All of these are places where you can have an impact and have a significant impact using these types of solutions. So, you know, as you look at your workforce, if you look at your data as to what happens, when you see any of these 4 areas, there's an opportunity there to dive in. Chelsea, let's jump to the next slide, please. And then the other thing that we look at when we're trying to decide how to attack these problems is not only the right areas to drive at, but how are they approaching it? So there's really 4 stages to behavioral change and 4 things you need to do to change behavior effectively. Okay, you need to raise awareness, you need to build people's intentions, you need to then prompt action in order to create habits. And habits are what we want, right? We don't want fluctuating, flip-flopping weight gain. We want long-term sustained health and weight gains or weight loss, excuse me. So, you know, looking at programs through this lens of, are they doing these 4 things? Are they collectively sometimes getting to behavior change and creating habits is key to deciding which programs and which vendors and partners you're going to work with. So you can see on the bottom, you know, health assessments are great at raising awareness, but they may not build an intention, right? So then you go to building intentions, and something of what like a wellness exam is going to be more effective at doing that. So you need this staged approach, or else you're just, you know, you're just raising awareness but not following through, which is not an effective way in the end. So when you look at these programs, what we want to make sure you're doing is you have all 4 stages of this behavior change covered, not necessarily with a single program, but with the suite of programs and approaches that you take. So, you know, what we wanted to convey here is, yes, there is a lot to do, but there is also a system and a logic to doing it. When Fred talks about operationalizing well-being, you know, this is what you should be doing, is starting with specific areas and then looking at specific ways and methods that different providers are using to approach that. Okay. So Chelsea, I think we can move to the first polling question. Whoops. So what we wanted to ask all of you is, what are your biggest challenges in terms, and remember, we're focusing on physical well-being at this point. We will ask more questions on the others, but what are your biggest challenges in improving, you know, the physical well-being of your workforce? And you can see those on the screen. We'll give you a minute to answer, and then we'll share those results with you. And I see there are a couple questions in the chat.
Yeah, so Chris, that's me asking for others to share their experiences.
Ah, okay.
If they're willing to do that.
Like, Fred, you're not allowed to ask me questions. We're on the same side here. Okay.
Looks like we're still getting some answers in.
Okay, so Chelsea, we probably gave people enough time.
Okay. Go ahead and show the results there. You all can see.
Okay. So yeah, interesting results. You know, like you, I'm seeing them right now. You know, the top few notable, right? Knowing which programs are effective, that's really what we talked quite a bit about today, was, you know, how to cut through all of the noise and all of the different vendors and all the different programs. And, you know, it starts with your data and your workforce, right? Understanding what their needs are and then figuring out the vendors and the approaches that might be effective. Yeah, the other one that's high on your list, not surprisingly, is vendor outreach, right? The worst thing that ever happened to wellness programs was caller ID. Nobody picks up the phone, nobody responds. So looking at the way that people and programs engage their employees, your employees are really important. And I would say just as important is branding it and making sure that you are seen as not only endorsing this, but supporting it, being a part of it, that people know that it is important to your company, rather than just something that United Healthcare is calling me again about, just as an example. So thanks, Chelsea. I think this was pretty interesting.
And Chris, there's a comment in the chat area
Yeah.
and a question that kind of follows that.
Yeah. Thanks, Carrie. For those who might not see the chat, it says one challenge we face is getting higher utilization of current programs. We are spending time branding and marketing. Any other ideas to increase participation? Yeah, it remains a significant challenge to get people to be aware of these programs. I think one of the realities is that people don't know about these programs when they need them, right? So what we've seen is the branding and the marketing that you speak of, but manager training, manager awareness becomes really important, because they might hear of something or hear of a challenge that an employee has. And if they're another source to say, hey, do you remember that we have this program? Have you heard about that? Don't forget this program. That's really one important one. Making sure you've got different ways for people to reach in. Making sure that you've got access to these programs for both the employee and their spouse, right? Do not gate the initial access to these programs deep inside your organization, because we all know that certain genders may not be as active in searching for these programs as others. So there are a lot of ways to increase awareness, which is really what we're talking about. And part of it, the last thing I would say is make sure that you're refreshing the programs. You'd be amazed at how many companies we go into, and before we get there, we pull up the list of programs that they have in place, and we say, oh, you've already got this wonderful suite of programs. And they kind of look at us and go, we have what? I didn't know we had that, because they just are plugged in and thrown in by different vendors along the way. And it's got to be a cohesive message and a cohesive program from you. So those are the things I'd say, quickly about that. And we're happy to, talk more, obviously. So let me not take up any more time. Want to make sure we leave time. I think we're moving to Joanna next. So let's move along, please.
Thanks, Chris. So I am our National Wellbeing Solutions Leader and Vice President of Clinical Consulting. So I work in the national health practice. I'm a registered nurse by training. I have a research doctorate. So I also spent 10 years in the carrier world when I transitioned from bedside nursing. I did nurse case, I'm board certified case manager as well, and I report to our chief medical officer. So a lot of what we do is look into this aspect of connecting all of these things together into well-being, and how does that really impact, your medical trend and your clinical outcomes. So I spend a lot of my time looking at this. And what I'd say is, one thing is we have to blame ourselves in the medical community a little bit, because we siloed these things. So we kept sort of your medical stuff over here and your mental health and well-being over here. I told a story the other day that, in 4 years in a bachelor's degree of nursing, I had 1 3-credit class, and that was on our, mental health and substance use. And my rotation was an inpatient psych unit. So very exacerbated diseases at that point. We're looking at things like schizophrenia and everything else. really not teaching nurses how to work with individuals that are coming in for a doctor's appointment and having signs of depression. So it's just something that historically the medical community hasn't been really good at integrating. And Chelsea, you can move to the next slide. But we learned a lot, in the last year with the pandemic. And even before that, this was something that was sort of creeping up that, we started to recognize more in our programming. Now, I put this statistic up top because I think it's pretty staggering. So a lot of articles are coming out today talking about, the cost of cancer rising above musculoskeletal. Business Group on Health keeps presenting a lot of this. But really, if you look at this staggering statistic that 6 trillion is projected in global cost of mental health disorders by 2030, and it will surpass the combined cost of diabetes and cancer. So on Chris's slide, we were talking about those things that you can kind of tackle that are really important, and mental health and well-being obviously needs to be one of those things. We're looking at, 18 to 25-year-olds. I'm with a client right now, and I was looking at all of their utilization data, and they have a huge spike in adolescent males from a mental health and depression. And we're seeing that kind of across the board right now. So it's really something that millennials and Gen Zs very much value accessing virtual care. They also value mental health support, and they also probably have the highest rates of depression right now. So it's something that, for the younger workforce, we really want to focus on, and, surveying the population and testing out vendor partners is probably a really good way to see what's working and what's not. You can go to the next slide, Chelsea. So talking through this a little bit, like more ways to improve access to mental wellness. So I talked a little bit about, the medical community not connecting the two, but even outside of that, there are not enough mental health practitioners that exist prior to the pandemic. Definitely don't have enough now. And not to make this even more upsetting to talk about, but there's not enough residency spots to even train people to be in those positions. So we really need to think about what are all those other modalities that we can do to supplement that kind of gap in the network. So somebody that's maybe subclinical or early signs of depression, can we do these other things to help support them? So when we think about, different things like preferences, so what is most important for people? Is it face-to-face connection? Do they like virtual care? Text therapy is a really big one with younger populations as well. So starting to look at what are the preferences of communication and engagement, what is different between different cultures and diversities, and then within individuals and families can drive some of those preferences and decisions. Privacy is a really big one too. So when we think about, and the pandemic is a good kind of snapshot of, we were all squished in the same room trying to work together, and you're trying to have private conversations, it becomes very difficult. Same thing with mental wellness. So if you're talking with a practitioner like this and you don't have a private space to speak because, either you're in a house with somebody that could be an abuser, they could be somebody that's enabling some of those habits that you're trying to break, or just in general, especially younger kids don't maybe want to have their parents hearing everything they're talking to their therapist about. So we have talked about with clients about providing private spaces at work too, to be able to take some of these appointments, an internet type of kiosk where you can have a shut door and you can have a private mental wellness appointment. So those are some things that you can think about in your actual space in your office and how you can encourage engagement. And then looking at the providers to make sure that we have enough diversity. Now, again, you're not going to change really what the contract is in your network, but a lot of these vendors are now starting to put on their network, who are the providers? What do they look like? What are their preferences as well, and pronouns? And so they're adding all those things because what we see is that if you have a provider with the same lived or liked experience as you are more likely to engage and be more open and honest about what's going on. So I'm not saying that one type of provider is going to be better than the other, but as a patient, you tend to engage much better with somebody that looks and acts and talks like you do. And it's clinically sound research. So there's actual clinical trials that have tested that out. So we do see that when you're evaluating a provider, ask those questions about their network, the diversity of their network, the availability of the information so that you can connect people together. And then looking at partners, so checking references and testing these services out, it's always really important to do that. Those network evaluations, so you want to take network evaluation outside of just that geo access, but getting down to the zip code level and looking at really what type of providers are available to people. So you will find that in underserved communities, there's less mental health providers available, there's less specialists available. And so evaluating the network, not just saying you have a 99% match of in-network, but really looking down into your community level, you can kind of ask some of those questions. And then how do we measure the success of this? So we really want to see that that's going to reduce your turnover, improve recruitment because you have employee satisfaction. So doing those engagement surveys and seeing those outcomes. Now across the bottom, I do want to call this out. So we have anything with mental health programs, you have to be very careful from a compliance standpoint. So if you're not aware of the Mental Health Parity and Addiction Equity Act, it's really simply put is you can't put any more restrictions on your mental health benefits more so than you would on your medical. So you need them to be equitable across the board. And so whenever you're looking at these things and you're starting to evaluate your benefits, you kind of want to make sure that compliance is looking to make sure that they're equitable across the board.
So
And
Joanna,
then,
Joanna, we have a question in
saw
the
that.
chat area, from Laura about supporting employees who are family caregivers. This may be more broad than mental wellness, but it certainly applies there.
Yeah, and that's really getting into sort of the social rate that we've been talking about. And yes, so we're starting to get a lot of employees talking about that outside of just EAP, right? So historically, your employee assistance program would have referrals to caregiving organizations to get like an in-home aid for somebody that might be ill, for example. But that's evolved way past that. So we're looking at individuals that may be taking care of a family member, but also you have children, so you're kind of sandwiched in between. So we are seeing a lot of, there are startup companies that are starting to do that, but it's in a virtual way. More so what I'm seeing are employers that are structuring benefits around paid leave time, flexibility and schedules so that you can, work to care for your family. There are, like I said, there are some programs where they look at getting volunteers like college students or moms that want to work part-time, and then they can come into the house a couple hours a day. So we are seeing some of those programs and lifestyle benefits, like I see Chris mentioning, are getting more popular right now. So do you want to go to the next slide? Okay, so shifting more to the emotional is what we start talking about. And we do talk about this a lot internally, not just with our clients, but also at Segal with our own colleagues and employees, because you have to be really self-aware of your emotional well-being. And if you're not doing well, you need to check in on yourself. So that's, that cognitive, behavioral, or emotional IQ. That's something that we talk a lot about, first of all, from an organizational structure. So if you are a leader, making sure that you understand your emotional intelligence, and then working with your employees to foster that bi-directional communication and making sure people feel comfortable sharing, what's going on with them. I always say, like, the first person that'll know that you're slipping mentally is probably your direct supervisor, because they can see it in your work and your day-to-day reactions to things. But if you don't feel comfortable sharing what's going on, then they can't effectively steer you to the right tools and resources that your organization may have. And then we talked a little bit about employee assistance program. And so the days of the old, 3 phone calls with a provider, and then, that'll solve your immediate need. And then if you need something, let's put you in the mental health network, and it might be out of network. So that old EAP model is really kind of shifting into a more enhanced program. And a lot of studies are actually showing if you have an episodical, stressor in your life, like a family member may have passed or somebody's sick and you're working through that, 3 to 4 visits are really not appropriate. It's more, they're actually saying like 7 up to 12 visits could be what you would need to get through that episodical situation. So the employee assistance programs are still good and valid, but what we're doing is we're coupling them with the advanced employee assistance program. So LIRA is a good example of one that we've coupled that with a client with the enhanced mental health network, so brick and mortar, but then put that LIRA on top of it, and it expanded visits for people virtually before they went into brick and mortar. Triggered intervention. So thinking about, a lot of people probably already have some critical incident support, but also enhancing training. So bias and harassment training, confidentiality in the workplace. We talked a little bit about that, but having that safe space for hotlines and difficult discussions. And then just, shifting the culture support. So the tone of how you're talking, your email, your communications, making sure that we're listening, removing bias, and being more inclusive and sensitive. So with that, can we flip? Yep. And so this will be the last slide in this section, but thinking more about social wellness. So making social connections. We just, Chris talked about the ROI on physical well-being. I mean, if that wasn't a case study of the whole world going through the collective trauma, I don't know what is. And so we all got, shoved in and completely separated from other people. So as a nurse, I'm kind of a dork about some of the science around this. There was a really great article about touch, and there's a reason why we like to be hugged. So it actually releases, chemicals in your brain to calm yourself. They teach you in nursing school, touching someone's hand will actually bring their blood pressure down when they're nervous and sick. So there really is that connection that we all lost for almost 2 years. So now we're starting to kind of remember how to be social again. And so just from individuals, teaching people how to prioritize self-care and being flexible, identify when work is becoming too stressful and you need to take a step away. Prioritizing physical activity, getting out and moving and being a part of your community again is really important for mental well-being as well as social. And then modeling these habits for your family members. We talk about this a lot internally whenever we're doing, discussions with our teams about, checking in on your well-being. Your kids are kind of modeling what you're doing without you even realizing it. And so with that, can we go on to our first poll question. So what barriers do you see to employees employees access mental and emotional wellness? So lack of provider access, lack of individual awareness, a perceived bias, privacy concerns, clinical programs maybe not meeting the needs of your population, affordability, and maybe I'm not sure.
Just an FYI, I think the poll question we're seeing on the screen doesn't match the poll question you have on the slide. It's asking about financial wellness programs.
Yeah, Chelsea, I think the poll number 3 is poll number 2.
Got it. No worries. Thank you for telling us.
And Chelsea, we're challenged for time here to get everything else in at the end. So we're going to cut this poll a little bit shorter than the last one.
Sure. We have about 10 responses in. Is 11. So we'll go ahead and look at those. That works for you, Joanna?
Yeah. Okay. So it's a little bit of everything. So it's coming back pretty even, lack of access, individual awareness, bias, privacy concerns, and just not having the right program. So obviously this is an area that's still a real challenge. A lot of people are trying to work through. And so it's definitely something that we've worked with clients about coupling some things together. Unfortunately, you have to Frankenstein a little bit of a couple providers or vendors. And we talked about that can provide challenges from communication and engagement. So with that, we're going to move over to Jonathan and then we'll wrap up soon.
Thanks, Joanna, and interesting observations. Jonathan Price here. I have the honor of serving as Segal's National Retirement Practice Leader. Really happy to be discussing this topic with you. Being financially secure is critical to this overall conversation. And why, you ask? Let's start with this headline, and you can Google and find something similar. Maybe numbers are slightly different. But what I was looking at, 4 in 10 Americans, only 4 in 10 Americans have enough savings to cover an unplanned expense of $1,000. We'll call that the broken boiler. Boiler breaks, $1,000, only 40% of the population. And furthermore, a recent study that we were reviewing, financial insecurity causes, and now think about this from a workforce perspective, 3 hours of lost productivity a week due to money worries, 1.6 sick days a year due to stress, 10 times more likely to not finish daily tasks, 9 times more likely to have troubled relationships with colleagues, which again, that becomes real performance issues at the workplace, and 2 times more likely to find a new job. So that there's a lot. I just threw a lot at you, but there are things that can be done, and this is a relatively new space. So let's take a look at the next slide and see what we can do. So what do we mean by financial wellness? And there are different definitions, and the line between each of these areas of wellness do blur from one to the other. What we're going to focus on here is the U.S. federal government's Consumer Financial Protection Bureau's hierarchical definition. Starts with stability, the ability to control your day-to-day and month-to-month finances. Moving on to peace of mind, which is the ability to deal with that broken boiler I mentioned on the previous slide. And then the third is controlled, tracking to meet your financial goals, which, by the way, implicitly means you have financial goals. And then lastly, you can actually live the life that you want to live. And before we move on to the next slide, what I do want to share is think back to the slide that Chelsea shared with the various survey results from the financial wellness section of the survey, and that you were under consideration for the next 2 years. And frankly, not surprisingly, the answers were varied. Why? Because ultimately financial wellness is about helping the individual reach these stages of life or these stages of well-being. And financial stresses and how to mitigate them, how to manage them, differ wildly across employees. That really is one of the key challenges. And so the next slide, what we're going to speak to is what can an employer do, or what does the landscape look like for an employer to start to address this relatively new emerging area. And as we go through these 4 quadrants, I really want to start by, I would say, congratulating or thanking the record-keeping community, the 401k providers, because they were in many respects the canary in the coal mine. They were the ones who first observed a problem, which was that when that boiler broke, the first thing that many individuals do, too many have done, is to take a loan on the 401k, stop the deferrals, and the like. And so 401k record keepers really were at the cutting edge and continue to be important players in managing their resources. They're very convenient and helpful resources because you already have a platform with them. You already have data feeds that go back and forth. So in many respects, piggybacking off of their infrastructure can be very helpful to an employer. Now, looking at 2 and 3, now 2 is all about education. So there's webinars, there's seminars, videos, modules, and the like. From our experience, and I'm sure I imagine from yours, that it'd be welcome to see comments in the chat box. Education has to be pointed, it has to be very specific, and has to be targeted to be action oriented. You're not looking to make an MBA, personal finance MBA, out of your employee, or maybe you are, but not necessarily for all of your employees. What you're trying to do is help them relieve their stress and feel in control of their finances. So really targeted education. And then for some folks, education is not enough, and 3 is about advisory services. And really that falls into a number of different areas, probably where the most PE money, to reference back a concept that Chris was alluding to earlier, is around the AI and advisory engines. So there's a lot of thought and money that's being brought into that particular area. But sometimes a person just needs a human being to be a coach, to be able to rest their stressed head on their shoulder and be able to speak through what are their issues and understand what are the resources, bringing together the various resources that the employer already has in place. So having the one-on-one coaching, again, making it action oriented, the one-on-one coaching and the like is really important. But what really those things are the wrapper around are the point solutions. And what do I mean by point solutions here? Again, we're going to keep coming back to this broken boiler just by way of a tangible example. One of the most common point solutions that are emerging is emergency savings funds. In fact, there's a member of the ESA, as I understand it, who's got something that they term a crisis fund. It's exactly what we're talking about here, money that's set aside incrementally into an account that's available to an individual when an emergency occurs. Now, emergencies are almost always, in this context, predictable, or at least unsurprising. It's just that they're unanticipated at that moment in time. And so helping the individual save up $1,000 or $2,000 into a side fund enables, when that emergency happens, when the boiler does break, when the car does need to be repaired, they've got the liquidity. They don't need to go to the 401k plan. They don't need to deal with credit card debt to be able to finance the broken boiler. Really important that these point solutions are ultimately become the focus around which these services, the education, the advisory services come. And now the question to an employer is, okay, so what do I do, right? So within this framework, we think there's a couple of important steps to be mindful of. First of all, and this is something I would recommend to every employer, do some basic gap analysis. Know what your current providers offer. Know what your current offerings are. And then think about, well, what are you missing? And then so there's that gap to know what are the areas that your employees do need help with. And then as importantly, the piggyback on that is data analytics. Know qualitatively, quantitatively how you can support and identify the different parts of your population, because maybe it's not employee savings, maybe it's student debt if you've got a bunch of 25-year-olds in college, or maybe it's elder care financial support if you've got a bunch of 50-year-olds who are helping some family member. Maybe elder care expenses is what's driving their pain point. So understanding your population, what's driving them, what their behaviors are, really is critical to be able to understand and be able to come up with the right solutions for your population. And again, this comes together like any other good solution with vendor management and ultimately engagement, because that's what's going to solve it. I want to go to one more slide before the polling question. And this is, to me, the critical slide when it comes to financial well-being and financial wellness. And allow me to actually set it up in a slightly roundabout way. EBRI, which is the employee benefits leading researcher, suggests that employers' top 3 issues when it comes to financial wellness. Number 1 is stress. Shouldn't surprise any of us. Number 2 is retirement preparedness. Again, no surprise. Number 3, healthcare costs. The third most popular reason why employers are putting together financial wellness is because of health programs, is because of healthcare costs. Financial stresses impact all these other areas of wellness that Joanna and that Chris were speaking about earlier. It means also the solving financial stresses will help with Chris's issues that he was talking about before about financial trend cost increases. So let's now turn to that last polling question, and we can get to that pretty quickly. While you're answering it, and while Chelsea's setting it up, I do want to share another little factoid from that EBRI study that I just alluded to, again, while you're answering the question. And that is, for those who do have financial wellness programs, how do they look like? Do they look like one-off incentive programs or holistic? And in 2021, 54% of those who have programs self-identified as being holistic. That is a great number, because it's up 12 percentage points from 42% from right before the COVID pandemic started. That is a great trend upwards from 42 to 54%. People are starting to see how you got to bring these pieces together to be really helpful to your employees. Do we want to? I'm not sure where we are, Chelsea, in terms of responses, but just given the time, do we want to?
Yeah, we're at 6 people. I was hoping to hit 10 before I shared,
Okay.
but let me look. Maybe we're at 7. But I don't think it's going to be any surprise to you, Jonathan, when I do share these.
Okay.
So let me just go ahead and do that.
Yeah, why don't you do that? Okay, cost and priority. So the organizational priority one is actually quite interesting to me. The cost to employees. One thing I remind you is think about that in terms of relative to the healthcare cost savings that it will help the employee and the employer. So just I do want to push a little bit in terms of your thinking. Think holistically when it comes to cost, because you've got the piece on Chris's side as well and Joanna's side as well in terms of cost. But with that, I'm going to turn it back to Joanna, I think, to maybe bring some of these slides together.
Yeah, thanks. So we'll wrap it up in, rather quick fashion here. So Chelsea, go to the next slide. So bringing this all together, the physical, mental, financial, and social, and we put emotional there kind of in between, because emotional feeds into both of those areas. So we listed some key priorities and things to focus on if you're, creating this holistic well-being approach to your employees. If you can go to the next slide. So how do you do that? So how do you move forward? So these are, this is somewhat of our framework of how we think about how do you plan your path forward. So thinking about what goals do you want to achieve, inventorying what you have. We talked a little bit about that, going externally, but then communicating and evolving. So just to kind of put a story together, we have a client in Texas, and they were really focused on a couple of things. So first of all, they really wanted to focus in on diabetes and weight loss, also physical activity and musculoskeletal conditions, kind of hitting those 2 key cost drivers. We worked directly with local Blue Cross Blue Shield, evaluating the right partner that we thought would be a good turnkey solution. They've had a lot of success in this past year doing that. But also we took a different approach from musculoskeletal. So they have a high deductible plan as well as an open access plan. Arasti is a really well-known provider in the Texas region. So we partnered with Arasti for that kind of general approach to physical therapy, and they have a virtual component. But we partnered with Hinge for the high deductible plan because Hinge is first dollar coverage. So we were trying to meet both the brick and mortar as well as those financial barriers to accessing some of those services. And we've had that in place for about a year and it's been very successful. So we did an employee survey. People really, really love the virtual physical therapy, and that has just taken off. In the diabetes solution area, we actually have seen over 40% cost savings on the RX trend. So it was very successful to use this framework to kind of key in on those cost drivers for individuals. Go to the next slide. So as you think about putting a strategy together, this is just something that we have actually sat with a client. This is a sample client. Everything was kind of removed from a demographic standpoint. But how do we think through your business case, and how do we plan out what we want to do and what success looks like for us? If you go to the next slide. So who's responsible? This takes everybody. So leaders prioritizing and being visible to your employees. So it's very important top down to kind of show that you're invested in this. Managers needing to operationalize and reinforce this. So like I said, they're the first ones to know something's going on and knowing what those programs are to engage individuals. And then HR being there to enable and encourage, this moving forward. And the last slide. So we can't talk about any well-being without approaching social determinants of health. As a nurse, and a board certified case manager, this has been in my life, my career. My job was to take a treatment plan and apply it to the population appropriately, but it is talked about more. So 20% of your clinical outcomes are based on a direct clinical intervention. And then 80% is everything else, your health behaviors, where you live, how much money you make, and your physical environment. So what has changed for you as an employer is it your responsibility to close those social inequities and gaps? So there are areas that you can focus on and evaluating and kind of addressing some of these things. And so with that, I know we're right at time.
Yeah, so thank you, Joanna, Jonathan, Chelsea, and Chris. Kind of felt like 4 presentations or the thought leadership topics jammed into one, and we went pretty quickly. This deck will be available to you after the forum ends, as will the recording. And what we're hoping you take away from today's forum is, number one, physical, mental, emotional, and financial wellness are interdependent. When addressed holistically, they form the foundation of well-being. Well-being is everyone's responsibility. It's not just an HR thing. During the past 3 years, mental health issues have doubled as a driver of cost for all the reasons that we know. Number 4, finances have become the number 1 source of stress. One size is not going to fit all. You'll need solutions that take into account office, site, traveling, remote, and hybrid workers, as well as those caring for others at home. And then finally, number 6, an integrated approach is needed to bring together the 4 dimensions of well-being, starting with an assessment of your workforce, what is working, and where you may have some gaps. So Chelsea, if we could move on to the final slide here. So again, my colleagues and I would like to thank all of you for participating today. Your great chat questions. Those of you that participated in the survey back in September, a sincere thank you to you as well. And please reach out to us after this forum ends. If you want to continue the conversation, we would love to. Or if you want to start an assessment process, that's something that we do for many of our clients. Or if there's some questions you have that just did not get answered here today, our QR codes are on the screen. So it's an easy way of getting our contact information. Feel free to reach out to any one of us. And with that, back to you, Cindy.
Hey, Fred, thank you guys. Really appreciate it. And what I'll do, I will be sending out the recording, which I'm stopping right now. And